Alright, so that concludes the sort of physical exam part of today's visit that I talked about. After all of that, I think you have what's called lumbar radiculopathy. So if you think of your spinal cord in your back as one long tree trunk, you have various branches that come off of that trunk, and those branches are your different nerves. The branches come off between the different bones, the different vertebrae in your back, and other structures as well. So if any structure isn't exactly where it normally is, or you move those structures a lot and lift weights, load them, essentially, there can be some pressure on the nerve and it can get irritated. And because the nerve branches are long and go through your limbs, that's why that pain can spread from your low back and then down the back of your leg to your knee. And that's also why certain activities tend to make it worse, like sitting for a long period of time or bending forward, because it's applying that slight pressure to the nerve. Lumbar radiculopathy usually responds pretty well to physical therapy, so I would like to see you twice a week for the next 6 to 8 weeks if that's doable with your schedule. We'll use physical therapy to learn some pain management exercises. So since flexion hurt and then extending your back, bending backwards felt better, we'll learn a way to do that to help manage your pain. And then we'll also work on some strengthening to help lower the chance of this happening again in the future. With your high blood pressure, I would like to talk to your primary care physician and help you schedule an appointment with them, especially just since they haven't seen you in a while, just to get a check-in on that and see if they would like to do anything to treat that, or if they just want to monitor it, or if it's nothing to be concerned about at all. With your concern about your age and this back pain, it's actually pretty common. So lumbar radiculopathy is most commonly seen between the ages of 30 and 40. So since you're right in the middle, it's pretty standard. Not that it's fun or easy to deal with, since it's definitely painful, but pretty normal for your age. And then with it happening again and potentially affecting your work, I think right now you're fine to continue working as is. We'll do some modification to help manage your pain at work, but hopefully by the 6 to 8 week point, you're feeling back to normal at work. In the long term, you could have flare-ups of this again that could affect your work a little bit, but with the pain management exercises we'll learn, you can hopefully manage a flare on your own. And then the strengthening that we do should once again help lower the chances of your pain returning at a later point. With that being said, let's go ahead and start some of these exercises. So today we're going to work on two. These are two exercises that we'll do in clinic, and you can also do every day at home. So the first is going to be repeated back extension. For this exercise, you're going to put your hands behind your back just like this, and you're going to bend backwards like this. And then hold it for a second, and then back up. So with that extension, make sure that it's not to a point of pain, and make sure that you feel stable, like you're not about to fall over or anything. And you'll do that 10 times. 3 sets of that throughout the day would be helpful. The nice thing about that exercise is if you're on a trekking route and you have a break, you get out of your truck and walk around a little bit, that's a great time to do 10 of these, sort of help alleviate the pain and pressure, especially after sitting for a long time if you're in pain. The next exercise we're going to do is a squat. So right now, squatting past 50% with your back not perfectly straight is causing some of your pain. Obviously, you need to be able to squat to lift things at work. So for this squat, we're going to go to just shy of 50%. So what that's going to mean is you're not going to go to the 90-degree mark. Your knees are not going to be in a right angle. It's going to be shallower than that. So for the squat, it'll be pretty standard. So feet shoulder width apart, knees forward. You're going to keep your back nice and tall, keep good posture through the squat, and you're just going to go down to before that 90-degree mark and then back up. So we're going to do that 10 times, and you're going to do 3 sets of that every day with about a 2-minute rest between sets. So between sets, that might be a nice time to do some of your back extensions, especially if that is helping you feel better in that moment. With that being said, do you have any questions?